I know in my profession, and I just did a video on this that's probably going to be released shortly about how representation matters,
Yes.
right? Because my demographics where I'm at is mainly Black, and them being able to see me put them at ease because I've had a patient come in and be like, yo, my doctor gave me these medicine and didn't go over nothing. I didn't really want to ask no questions because they were trying to rush me out.
Yeah.
Can you talk with me? And
Yeah.
I sat down and like really had a conversation with the person
Mhm.
and like broke the medications down, showed them how to use like the inhalers, why everything. We had like a whole medication therapy management session for this person and
Yeah.
like our clinic room because I didn't want her to do it outside the pharmacy. And they
Yeah.
came back about like a week later and were just like, yo, I really appreciate you for doing that because no one has ever did that. Like I go to my primary care doctor, I go into the ER, and they were just like, this the issue, here you go. So do
Mhm.
you feel like representation matters, or do you see something with your patients that are Black and brown? Like, do you have an instant connection? If you don't mind talking about that.
Yes. And so one, thank you so much for doing that for that patient because that's huge. Because they probably were driving home after their visit, like, I don't know what I'm taking. I don't know why I'm taking it. I don't know what this is gonna do to me. I'm probably not gonna take it. And the next thing you know, 5 months later, they're in the ICU and everyone's mad at them for not taking the medication they didn't know to take.
Yeah,
So
and one of the things was like the inhaler, and he had issues breathing. So you're like, yo, I can't breathe. And like,
thank you.
yeah.
Help me. He so yes, I really feel like representation matters for some, specifically for situations like that, because we understand that there is a disconnect, you know? Like I think we look at it as, if this was my mom, would I be okay with somebody treating them like this?
Yeah.
You know? And I know just historically, Black, brown, and people of minorities are overlooked. They're assumed that they are not educated. They're assumed that they're not going to be compliant, especially if they are in one of if they're a Medicaid patient or something like that. All these bad assumptions are there. So some doctors who are not Black or brown will think that they're wasting their time,
Yeah.
taking that time to sit down and discuss with them, or they feel like they don't know any better. So why would I? Or
Mm.
I talk to them about it, but you use all jargon and you use all terms that you didn't know until you went to medical school. And I don't remember when Mr. Jones went to medical school. Do you? So like, don't get it, So like, I think we also just take that next step and think a little bit further, especially with our Black and brown patients, because mind you, we see ourselves in them,
Yeah.
like I've had friends who are lawyers who had the doctor walk in there, not even introduce themselves to them. She was going to the dentist. She had a problem with her tooth. The doctor walked in, didn't say, I'm the doctor, didn't introduce himself, didn't greet her, walked in, started putting his fingers in her mouth, trying
Mm.
to evaluate her, and was like, I don't even have the time to talk to this woman because she's probably not even know what I'm saying. Mind you, sis is a whole Juris Doctorate. So like she can definitely understand what you're gonna say. And so I also think the piece that I see a lot from our side is just the mistrust from what has everything that's happened, the with the whole Tuskegee incident, with just the paternalistic views that physicians used to have, where you do what I say, you don't ask questions about it,
Yeah.
especially if they are in like the Medicaid clinic, or like they're like, we don't care. But I truly do. And I found times when my patients would be managed by another doctor that I'm just like on the team, and they'll
Mhm.
like look around and look at me like, what do you think? Because I don't trust him. And why do you not trust them? Because of just historical things. They might be a white man, they might be a white woman who's not really talking to them like they're a person, and talking to them like they're a problem that they're trying to fix.
Yeah.
And so you find comfort in your people. And there's just a different level of understanding when you know what they might be going through.
Definitely. Definitely. That was dope. That was
Yeah.
dope. I like that. So I got a question for you.
Yeah.
We're coming out of the pandemic, it feels like. And I believe last year you started your residency. So
Hmm.
how was it working inside of the hospital?